Hi everyone, I'm Richard Casey and I'm honoured to be part of this important conversation today hosted by the International Partnership for Dogs. I've had the privilege of working in the veterinary sector for almost 15 years across a variety of different roles and organisations. While I began my career in human resources, and it wasn't exactly in my early career plan to join the veterinary sector, but when I did, I quickly realised I had found something special. What's kept me here over the years is the chance to combine my two greatest passions, people and pets. I've always been fascinated by what motivates and supports individuals and teams, and in veterinary practice, we see how closely that intersects with animal health, public well-being, and community health too. Today I serve as the Executive Director of the World Small Animal Veterinary Association, or WSAVA, or WSAVA for short. We're a global not-for-profit association that unites over 115 veterinary member associations from around the world, and we represent more than 300,000 companion animal veterinary team members globally. Our work focuses on advancing the health and welfare of companion animals by setting global standards in both clinical and non-clinical aspects of veterinary care, delivering accessible, high-quality continuing education through resources like the WSAVA Academy and our annual Global Congress. We work to strengthen the global veterinary community by fostering leadership, collaboration and professional support, and campaigning for change, advocating for the recognition and inclusion of companion animal professionals in animal welfare policy, One Health planning and global development agendas. At WSAVA, we provide a trusted and collaborative platform for sharing knowledge, building equity and driving progress, particularly in regions where companion animal practice is still developing or under-resourced. Today I'll be sharing a brief strategic high-level overview of the global state of companion animal veterinary practice, what's changing, where the challenges lie, and how together we can shape a more inclusive and impactful future for pets and people. I'm going to begin by exploring 4 trends that are actively reshaping the landscape of companion animal veterinary practice around the world. Across the globe, we've seen a significant rise in pet ownership, driven in part by the COVID-19 pandemic. And in many countries, pet acquisition surged during lockdowns as people sought companionship and emotional support. However, more recent data from several regions, particularly in parts of Europe and North America, suggests that rates of new pet acquisition are beginning to stabilise or even decline back to pre-pandemic levels. What hasn't changed though is the deepening of the human-animal bond. Especially in urban areas, pets are increasingly regarded not just as animals, but as family members. This emotional connection is influencing not only the frequency of veterinary visits, but also the expectations that clients bring with them into the consulting room. Today's modern clients are looking for more than just clinical care. They want experiences that are personalised, transparent, and convenient for modern, busy lives. So what does that mean? It potentially means clear, two-way communication, shared decision-making, options such as telemedicine, online booking, home delivery of medication, and mobile vet services. These expectations are not limited to high-income countries. In many low and middle-income settings, technology is enabling new models of access, particularly through mobile apps, community-based veterinary workers, and remote consultation platforms. In short, veterinary services are being redefined what clients value and what they perceive as accessible and trustworthy care. But these rising expectations are colliding with a profession under pressure. In many countries, there are shortages of veterinarians, veterinary nurses and technicians, and other paraprofessionals. This is especially true in rural and underserved areas. And at the same time, in regions such as Latin America and parts of Asia, the issue is the opposite, with the number of veterinary team members sometimes outpacing job opportunities or available infrastructure. Regardless of geography though, one concern is consistent, and that is the workforce well-being of the veterinary team. Rates of burnout, compassion fatigue, moral stress, and mental health challenges are high, and in some countries worryingly so. Another widespread dynamic is the gender shift within the profession. Veterinary medicine is now predominantly female at graduate and early career levels in most regions, yet senior leadership roles remain male-dominated. This gap raises important questions for us about equity, opportunity, and the future shape of leadership in the profession. Taken together, these challenges affect not only the daily reality of veterinary teams, but also the long-term sustainability and resilience of companion animal healthcare systems. At the same time, we're seeing extraordinary clinical progress. Advances in diagnostics, pain management, disease detection, and treatment options are transforming the scope and sophistication of companion animal care. Personalised medicine is becoming more common, from tailored nutritional plans and behaviour interventions to genetic testing and oncology protocols. But access to these innovations remains unequal, not just between high and low income countries, but also within countries, between urban and rural settings, and between affluent and economically marginalised communities. This uneven distribution of progress reinforces the need for global equity in veterinary education, infrastructure, and innovation access. These four trends, shifting expectations, workforce challenges, technological evolution, and unequal access, are shaping a profession that is evolving fast, but certainly not evenly. And that brings us to one of the most urgent realities we must confront: the stark disparities in access to veterinary care around the world. One of the most important issues we must acknowledge is the global disparity in access to veterinary care. As we've already touched on, the rise in pet ownership in many regions has not been matched by an adequate increase in veterinary infrastructure. In some countries, there are simply not enough companion animal clinics to meet growing demand, particularly outside major cities. In regions where companion animal veterinary practice is still developing, veterinary education and training curricula may still focus predominantly on production animals. Access to essential medicines, diagnostics, and equipment remains a major barrier. The supply chains may be inconsistent, prices prohibitive, or regulatory systems lacking. The cost of care can be a significant consideration for many pet owners around the world, and is one that is growing more prevalent in the media. Veterinary care may be paid for out of pocket, and pet insurance options, if they're available at all, may be limited in reach and scope or their affordability. Financial accessibility naturally plays an important role in shaping whether, when, and how people are able to seek veterinary care for their pets. These decisions also exist within a wider cultural and community context, which influences how animals are perceived, valued, and cared for. In some communities, pets are regarded as beloved family members with strong emotional bonds between them. In others, companion animals may be viewed as working animals, guardians, or even protectors. And in many parts of the world, animals are community-owned. They are not tied to a single household, but are cared for collectively and play important social or environmental roles within their communities. These diverse perspectives shape how and where veterinary services are accessed, and they underscore the need for locally informed, culturally sensitive approaches to companion animal care and outreach. And despite these challenges, companion animal veterinarians are increasingly critical to global One Health efforts, particularly in the prevention and control of zoonotic diseases, antimicrobial resistance, and the broader field of public health. However, their contributions are still too often overlooked. Companion animal professionals remain underrepresented in national policy dialogues, animal health strategies, and development frameworks. At WISAVA, we believe this truly must change. We are actively working with global partners such as the World Organization for Animal Health to raise the visibility of companion animal issues in national animal welfare legislation and policy. Our goal is to ensure that the role of small animal veterinary professionals is recognised, valued and supported, so that every community, regardless of geography or income, has access to high quality, compassionate veterinary care. So where are the opportunities to build a more equitable and resilient future for our world of companion animals? I'm going to highlight 3 areas where momentum is building and where collaboration can drive meaningful progress. First, digital tools are transforming how veterinary care is delivered, accessed and experienced. From AI-assisted diagnostics and remote triage platforms to teleconsulting apps and digital healthcare records, technology is enabling more efficient, scalable and user-friendly services. In underserved or geographically remote regions, mobile veterinary platforms are proving especially impactful, bringing advice and triage to communities that may not have a clinic nearby. These tools are also supporting veterinary teams by giving them easier access to specialists outside of typical general first opinion practice. Of course, the value of these innovations, though, depends on ensuring digital literacy, data privacy, and infrastructure support, but the potential to reduce barriers and extend reach could be significant. Secondly, partnerships and investment in people are essential. At USAVA, we're placing particular emphasis on leadership development and professional empowerment. Our Future Leader program is designed to support emerging veterinary leaders from around the world, especially from regions where structured leadership development opportunities may be limited. And in parallel to this, the USAVA Academy provides access to evidence-based educational content, enabling veterinarians everywhere to engage in continuing professional development, regardless of their geography or income level. These kinds of global initiatives can help level the playing field, but only if they are co-created with local partners, that they respect diverse contexts and recognise existing community strengths. Supporting veterinary teams in their own environments rather than importing solutions is really key to the long-term impact. And finally, there is growing momentum around ethical and sustainable practice. Around the world, veterinary teams are increasingly aware of their environmental footprint, from waste and resource use to anaesthetic gases and travel. There's also greater recognition of ethical dilemmas many veterinary teams face, balancing animal welfare, client expectations, financial limitations, and public health risks. In response, we're seeing an expansion of veterinary ethics education and more open conversations about social justice in access to care, end-of-life decision-making, and burnout linked to moral distress. As a global veterinary community, we are learning to hold space for complexity and to develop frameworks that support responsible, contextually appropriate choices. In all 3 of these areas, digital innovation, human capacity, and ethical leadership, the opportunity is not just to modernise veterinary care, but to make it more inclusive, compassionate, and sustainable for the long term. So as I conclude, what is possibly needed now more than ever is a collective commitment to move forward with intention and inclusivity. Specifically, what we need is a stronger cross-sector collaboration where companion animal professionals are meaningfully included in global health and development planning. A greater investment in education, infrastructure and professional support, particularly in low and middle income regions where need is often outpacing the resource available. And above all, the leadership and courage to reimagine veterinary systems in ways that are inclusive, ethical and sustainable. As the global voice for companion animal veterinary teams, USAVA firmly believes that no animal and no member of the veterinary team should be left behind. Every community, regardless of geography, culture or income, deserves access to compassionate, evidence-informed veterinary care, delivered in a way that respects local realities and empowers those that are providing it. The future of companion animal veterinary practice will not be built by any one organisation or sector, it will truly be built together. So to those of you here today who are part of the veterinary team, thank you for the vital work you do every day in your communities. And to the many others who work alongside the veterinary profession, your partnership and support is deeply valued and essential. If we work across borders, across disciplines, and across differences, we can shape a profession and a future for pets and people that is not only clinically excellent, but also equitable, resilient, and globally connected. Thank you very much for your time today, and enjoy the rest of the conference.